All right. Good afternoon, everyone. My name is Jill Flessing, and I serve as the chair of the Addiction Counselor Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Thursday, September 11th, 2025. I ask that the members of the advisory committee respond to a roll call to signify their presence at this open meeting. It is being conducted remotely by conference call and other electronic medium. Denise Sisman.
Present.
Christina Boyd. Lisa Carter. Jason Griever.
Present.
Chad Jacobs.
Present.
Mike James. Working on it. Charity Cosson.
Present.
Crystal Norman.
Present.
Dulcinea Rakestraw. Judy Roycer.
Present.
And Judy, how do you say your last name?
Pronounce it Reeser with a long
Reeser.
E. Mhm.
Reeser, okay.
Yes,
And
thank you.
Zenova Williams. I note the following BSRB members are also present. David Fye.
I'm present, and Leslie will probably not be in attendance unless we need her to log in later.
Okay. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Jill. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On August 20th, 2025, we sent notice of the advisory committee meeting to all individuals who had requested notice of the meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Okay. The meeting is now called to order, and the advisory committee will begin its discussion on the first item on the agenda.
And Jill, I did notice Michael James is also logged in, so he is present now as well.
Okay, thank you. Okay, the first item on the agenda for consideration is approval of the agenda. David sent out the packet for the meeting today earlier. If anyone has changes to the agenda or additions, please let us know. If not, could I get a motion to approve the agenda?
I did notice that it said the meeting was going to be called together at 10 a.m. as opposed to 1 a.m. I don't know if that matters.
We can go ahead and fix that on the official copy of the agenda, but good catch. Yeah, we'll just go ahead and change that on the agenda.
In that case, I would move to approve the agenda.
I'll second.
There has been a motion, it's been approved, or a motion and it's been seconded. All those in favor of approval, say aye.
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 All those opposed, same sign. The agenda has been approved. The second item, or the third item on the agenda, is review and approval of previous meeting minutes from both March 5th and June 3rd. If everyone has had an opportunity to review those meeting minutes, are there any additions or changes to the meeting minutes? If not, may I get a motion to approve both the March 5th and June 3rd meeting minutes?
So moved.
Is there a second?
I second.
Okay. All those in favor of approving the minutes from both March 5th and June 3rd, say aye.
Aye.
All those opposed, same sign. And the minutes from the 5th of March and June 3rd have been approved. And I see that Zenova is also on Zoom with us. The next item of business is the executive director's report. David, I'll turn it over to you.
All right, thank you, Jill. And at these meetings, I do try to provide some updates on BSRB operations, as well as some legislative updates, and then items from most recent board meetings. So we'll jump right in. We did hold a board meeting just recently on September 8th, and I will start with some of the updates from that board meeting. When the board met, the board is working through one of the major projects for this year, which is the review of unprofessional conduct regulations. You spent quite a bit of time as an advisory committee, as does others, going through your unprofessional conduct regulations, making recommended changes for the board to consider. And the board is going item by item now with a giant grid of all of the unprofessional conduct items, deciding if there should be uniformity of language across the professions, or if there are any items missing from certain professions that should be added. And it's been really good work by the board. I think this will continue through the end of the calendar year, but the board was able to go through several of those. So there was also some new appointments to advisory committee members for the Behavior Analyst Advisory Committee, Marriage and Family Therapy. There was a discussion at the board meeting. There was a company that had come before the board a couple meetings ago from a group called eBoss, and that organization provides some disciplinary remedies that are available to licensing boards as a tool. If someone is found to have committed a disciplinary violation, there's a consent agreement order process by which the board can enter into an agreement where the person can undergo certain things. And some of these things can include things like discipline in the way of supervision or counseling at times. What this company does is it creates sort of paths where people can focus a lot on a certain subject. So if there was a violation in the area of, let's say, confidentiality, what this company could do is it could steer the person through a process by which they would undergo some education in that area and then be tested to show that they had improved their knowledge in that area as far as, for example, confidentiality. So there could be some tests that would go along with the person demonstrating increased competency. There's also some essays that they could implement to have the person work through some of these issues to make sure that they had, improve their skills and, receive the information that the board was communicating to them because of the disciplinary violation. And so the question was, does the board want to have this as a resource available to them if the situation should arise where the CRC would want to use this as a resource? And the board did decide that this is appropriate for the CRC to use if there would be situations to where they would want to work with that company, eBoss. This is at a no charge to the board. Essentially, the licensee, when they enter into that agreement, they would be agreeing to the cost of the service provided by that company. And that's why there's a negotiation process during those consent agreement orders. And so since there was no cost to the board, there did not need to be an RFP type process to utilize a company's services like this. But we did want to get direction from the board that the board would approve of that. And the board did approve of that at the meeting. We also shared an update in terms of the background check requirement the board is implementing this fall for licensees. The board previously voted to go ahead and require background checks, and the board does have statutory authority to require background checks. In terms of getting that process moving forward, we had received some information from the Board of Nursing and their website in terms of some of the documents they have to guide people through that process. There's also some information that has to do with waivers that people are signing when they submit to the background checks. And then also a way for individuals to challenge certain findings that come up through some of those background checks. So we're probably going to borrow a lot of that language from their process as we implement this for the licensees. And again, as a reminder, this would be for new licensees, individuals who are reinstating their license. It would be, the board is seeking to have this also as an option for people to opt into if they wish to do this as a requirement of a multi-state compact. So that is moving forward. We'll have more information exactly how this will all work together in the future as we kind of learn if we need to implement a regulation for this process or if we can move forward on that faster. There was also a discussion the board started concerning when individuals are under direction versus under supervision. There is certain language that does require individuals who are not at the independent or clinical level to be practicing under supervision or direction. And there is some language that does talk about when individuals have to provide notice to clients that they are working under direction, or excuse me, under supervision. But the same language for under direction does not appear in the same places in every spot in the regulation. So the board is going to have a more in-depth conversation about that at their out-of-town planning meeting, but they wanted to start the conversation and show that they intend to communicate about that further. And speaking of the out-of-town board planning meeting, that will take place at the end of September. It will be September 29th, and that will be an all-day meeting in Manhattan, Kansas. That is open to the public. That meeting will start at 9 a.m. and go until about 4 p.m. And it will be mostly for board items that require more in-depth discussion. We have tended to have kind of very tidy board meetings over the last few years where they start at a specific time and they go about 3 hours and they end. So it usually goes from 10 a.m. until 1 p.m. But there are certain topics that do require some additional discussion. And so for the board to fully work through those items and consider other items, that's why the board holds that annual meeting in person. So as I said, that'll be on Monday, September 29th at 9 a.m. And that will be in Manhattan, Kansas. Moving next to some legislative items, there have been a few legislative committees that have been meeting over the interim, and I just wanted to make you aware of a few. There was a committee that met recently that dealt with human services and social services, and it was chaired by Representative Will Carpenter. That committee was looking at staffing for the state hospitals and primarily looking at contract nursing. And so there was some testimony by a few different groups. So those meetings are available on the legislative YouTube channel. You're welcome to go and watch those meetings. There was also a House Select Committee on Government Oversight that was reviewing items specific to the operations of the Board of Nursing. Some of that information looked at some of their disciplinary processes and some of their operating processes around renewal of licenses and how the board responds when licenses are getting close to being expired. So there have been 2 meetings about that topic, and you are welcome to go back and track those meetings as well. And then there have been a couple meetings on government efficiency by the Senate. If there were meetings on Tuesday and Wednesday of this week, it appeared that the primary focus of those meetings was on the state fire marshal, but there was some other topics that I thought were of interest. One of the topics, I haven't gone back to watch the meeting, but yesterday afternoon, one of the topics on the agenda was using AI to find efficiencies in government. And so I believe it was by a company called Accenture who was doing that presentation. So I have not had a chance to review that, but you may want to take a look at that if that seems something like interest to you. So, and then in terms of just other operations for the BSRB, one of our major undertakings this year has been to do the surveys for all 7 professions. We did do a different set of questions for every tier of licensure, and so it was quite an undertaking. All in total, we probably had about 25% of our licensees voluntarily do the survey, which for us is over 4,000 people. And so really want to compliment the work of my staff. They did a lot of work to help with the construction of those surveys and implementing the surveys, getting the information out there. And then also, once we had collected the information, they've been working on summarizing it in your packet of material. You will see the second version of the draft report for addiction counseling. It is not 100% complete, but there has been a lot of work that has gone into it. It's 116 pages long. Part of this is because we did want to provide some summary information to individuals, but also for individuals who wanted to really get the tone of the responses. We wanted to be able to provide those open-ended answers. So the way the reports are structured is summary information towards the beginning, and then towards the back, there's a number of appendices for every question that had an open field answer. And so you can go back and review all of those answers if you want to kind of get into the specific responses people provided on the survey. But our staff is continuing to work through those. We should have those completely done by the end of this year. We should have one copy of the report per profession, and then we will also have a comparative report across professions when we were able to ask similar questions for different levels of licensing. So looking forward to having that process wrapped up. And then another item as far as operations, we will be, a few of my staff members and I will be attending a training next week. There's a conference that will be put on by a group that deals with licensing boards. It's called CLEAR. And we'll be attending that conference, the two investigators for the board, as well as my assistant director and my assistant. So we'll be attending that. I'll be attending the Marriage and Family Therapy annual meeting for their association on Monday. Those two conferences have kind of been put together. So I'll be attending that with board member Mary Jones. And then just one other update about operations, and that is that every year the BSRB does submit a budget for the state of Kansas to review. Last year, we submitted a revised estimate on expenditures for fiscal year 25, as well as a request for 26 and 27. The legislature did approve a budget for us. We don't receive any money from the state general fund or from the state of Kansas. However, we operate based on the license revenue that we receive, and we request a certain expenditure limit every year. So even though we have money in the fee fund, we request a certain limit and that we don't spend above that limit on a year-to-year basis. And then the legislature does ask us questions and provide oversight, but our annual budget is due to be submitted on September 15th. So we'll turn that into the legislature on that date, as well as some performance measures for the agency as well. So with that, I think I'll go ahead and wrap up my report and see if there's any questions on operations, legislative items, items from other board meetings, or anything else that you have questions about today.
Thank you, David.
I had a quick question
Mhm.
for David. And maybe it's still up in the air though. For the requirement for the background check, do you know, I guess, like, what are some thoughts about who will be paying for that, or how will that be submitted, or who will be responsible to get that information? Will the BSRB ask the applicant to do it? Will the applicant have to go through like their state or their police department to send it? Or I don't know if there was like thoughts about that.
Yeah, so the models that are out there, the cost for the background check with the KBI is $57, and that'll be the only amount that's charged. So we're still working through if we'll be collecting that or if they'll go directly to KBI. But if it is collected by us, it'll be treated like a pass-through fund, essentially. And then we'll just turn it over to KBI if we collect it. Individuals will need to go and get the fingerprinting done at their local law enforcement and then send it to the relevant entity to do the background check. As I understand it, we will get access to a portal where we will be able to check to see if there's issues, and if there's no issues, we'll be able to move forward. If there are issues, then that is something we'll have to investigate to see if that is something that will affect the person's ability to get a license or a multi-state license, or whatever it's being used for. So that is how it will work. It won't be any additional money in terms of our operating budget. However, it might appear on paper that our budget goes up because of the pass-through fund. It'll just be money coming in, money going out. But it looks like it'll be that flat cost is pretty established as $57. And this won't be something that we will have people do upon license renewal or on a regular basis. It will just be upon the initial application for licensure, if somebody's reinstating a license, or there is some statutory language that does allow the board to use it in certain investigative processes, but I think that's going to be less frequent. We also would like the ability to have people opt in for the background check, because some of these multi-state compacts require that someone have a background check as a condition of licensure. And in the past, we have not had that as a condition. So it could limit people's ability to practice under the compacts until we have that into our requirements. And some of the compacts have basically said, this is a requirement of the compact, but we will give you a certain number of years to make this a requirement. That's what the SIPAC compact did for psychology. What they did is they said, we'll give all states 10 years to make this a requirement. In the meanwhile, your licensees can practice, but this is something you need to come under compliance with eventually. However, for professional counseling, what they have said is, you need to make this a requirement, and your licensees won't be able to practice under the compact unless they have done the background check. So that is part of the reason where we're trying to move forward on this fall. And then the social work compact, that compact is enough states have passed it for the commission to be meeting and doing rules and starting to work on the data system and all that. But that compact is still about a year away from being fully live. And part of that is because there was just a decision by the commission to have the executive council begin contract negotiations with one of the companies for a data system. So there still is some work that would go into what exactly they'd be asking for. And then the data system will need to be built. And then they'll receive some data to be tested. And then as long as everything looks good, at that point, they would have it go live. So I'd say based on other compacts, we're still a year away from social work. Professional counseling, they're targeting this fall. But what they've said is they will go live with the states that are ready to go live. And then they will add others as they are ready to go live.
Okay, yeah, because I was thinking about Washburn, because we do, at least our criminal justice system, or criminal justice department works with KBI. So I was just wondering if maybe even through Washburn students, we could maybe do a connection that way, and like maybe even be able to help. But yeah, since it's up in the air, I'm just trying to think about those things. So.
Yeah, and it's a good question. We did ask, we were told by a number of entities that, there's people that have already done background checks recently for employment and other things like that. And might there be a way that some of that information could just be shared with the licensing board? And unfortunately, it sounds like it can't work that way. It sounds like it has to be separate for different purposes. So unfortunately, this does mean some people might have to do a background check after they did one for another reason. But this will make sure that we have it meeting the compact requirements, and then we won't go back to look at everybody who's already been licensed to make them all go do it again. It'll just be if people want to opt into it for the compacts, and then for people who are newly licensed, it'll be a new requirement once it goes fully live.
Okay, right, thank you.
All right, if there aren't any other questions, we'll move on to new business. The first item under new business is review and discussion. Nope, that's my mistake. Back up. The next item on the agenda is old business. And the first item under old business is continued review and discussion of draft report of survey of licensees. David, I'm going to turn this back over to you, as you and your staff have spent an enormous amount of time with this information. And I have not gotten to look at it in depth today as I've been seeing clients. Wonder if you could give us some summary thoughts. And I know we discussed in our preparation for the meeting, looking at it more in depth in later advisory committee meetings, but could you give us some more background, please?
Sure. I'll go ahead and share my screen. I've got a copy of the version 2 of the draft report. Okay, can you all see the copy of the draft report?
Yes.
Okay, looks good. Okay, so as I mentioned, this is version 2. The last copy that you received was quite a bit shorter, although the main reason for this is because I believe there are 29 appendices that have been added to this copy of the report. For addiction counseling, we have tiered licensure that has 3 levels of licensing. And while there were some questions that were the same, there were others that were different. And so we did separate out the questions by level of licensing. And so there was a version that was sent to the LACs, a version of the survey that was sent to the LMACs, and then a version that was sent to the LCACs. And so for questions where there was grouped information, we put those together. For those that was different, you'll see some of the differences there. But just as a reminder, let me go ahead and see if I can try to pull up that report again. It looks like for whatever reason, it came up blank, but we will try to pull that up again. And if there's an issue, I may have someone else maybe share their screen if there's a conflict here. But just to kind of summarize, for the other professions in general, we had about 25% of our licensees complete the survey. And so the results are listed here. And we did go in order of the questions from the survey. The final report, we've had some discussions about if we might change that. Okay, it looks like this version I pulled up here is a little bit better. So we'll go ahead and try that again. We want to make sure that we're being good stewards of the information. People who took these surveys were very generous with their time and gave us a lot of good information. And some of this deals with workforce, and some of this deals with maybe some areas in which the board and the advisory committees can focus on over the next few years, even in terms of identifying issues and working on solutions here. Once that fully loads, we'll go ahead and kind of move through it. But basically, the survey report was our way to provide the information back to the board and also share it with other members in the community. We do realize that some of the information we collected in these survey questions may not be things in which the BSRB is able to be, most helpful. But we want to have good conversations with other partners. And then if there's things that maybe we can share this with, let's say, for example, the Department of Labor, or maybe some of the associations that advocate for the professions, we can share this information and they can kind of pick it up and run with that information. So as I mentioned here, beginning information does talk about how in Kansas we have the tiered licensure for addiction counseling, how this was sent out to all of our addiction counseling licensees. Back in January of this year, we had about 1,500 total licensees, and you see the numbers kind of broken out there. The survey was open for about 31 days, and in total, we had a response rate for addiction counseling of about 27%. And then it kind of groups there. The biggest response rate was the LCACs, which we did have about 30, almost 2% complete the survey, which is great for a voluntary survey. And since the last time that you did receive the survey, we've gone through a few more of the open-ended answers. And so we provided some summary information that you didn't have last time you looked at it. One of those did ask, what counties people provide addiction counseling services in. And this may be intuitive, but some of the major population centers appeared to be the most frequently highlighted counties. There were a number of individuals who highlighted multiple counties, but for the ones that only mentioned one, it seemed like Sedgwick County had the most responses for all three professions combined. But for clinical addiction counseling, Johnson County edged it out in terms of counties in which people practiced in. Although Johnson County was still very high, and then Shawnee County was represented fairly well, and then Douglas County for a couple of the professions, and then Saline and Lyon. So you may recall we walked through the survey at the last time and talked a little bit about some of the demographic information. And so that information is unchanged since the last time you did review this report. We were able to go ahead and take some of this information that asked about, do you maintain an active license but no longer work as an addiction counselor? If so, explain why you're not providing services currently. And so a lot of that information is summarized in the back there. But we did include some of this as summary information. And now you'll see responses that says, if you want to see the open field information, you can go to Appendix 4, for example, on page 45. Or for the LMAC responses, you can go to Appendix 5 on page 47. And so just to kind of give you an example of that, let's go ahead and jump down to one of those sections. So here in the back, I mentioned that there's now 29 appendices. You will see the header for the appendices and then which group of respondents answered the question. If there were responses that had more than one response, we tried to bold this and then list how many people responded with that answer. For some of these where individuals went into detail as much as possible, we tried to preserve the voice of the person who responded. We did make some edits if something was too self-identifying or could be identifying to a licensee because of a location where they worked, or some individuals may have presented their phone number or information there. So we did remove that to make sure that we were able to provide anonymous information from the survey. But I think you will still see that the survey question and answers did provide a good amount of information as far as how people responded and then some of the reasons why they responded in a certain way. And so, as you can see, some of the people just responded with a simple no. And when that was the case, we tried to group those responses. But then there were other other answers, and people felt strongly about certain questions. And we wanted to make sure that when people did communicate with those strong feelings, that we had that information here for your review as well. So we do kind of reference which appendices it is. So as you continue to work through this report, I hope that you will find this information helpful towards the back. So as you go through the report, continue to work through the summary information. But then when you get to those questions where it makes reference to the appendices, go ahead and look through that as well. So there's a couple of questions that we are still having staff go through. One of those is question 9 that says, are you currently working towards attaining a licensed master's addiction counselor? We asked that to the LACs. Or for the LMACs, we said, are you currently working towards attaining a licensed clinical addiction counselor? And that was for the LMACs to see if they're going for their LCAC. And if they're not taking steps to do that, we asked them why not. So those answers have now been attached to the back. And between now and your next meeting, we'll have that summary information provided. So there will likely either be a third version of the draft report, or perhaps by that point, we'll have the final report with that information cleaned up and that summary information available. In the meanwhile, you can look through those answers and kind of see what the trends were. The only other question like that is question 11. And it says, currently no multi-state compact exists for the addiction counseling profession. If a multi-state compact was created under a model that would allow individuals to practice in other compact states by changing from a single state license to a multi-state license for an additional cost, would you be interested in obtaining a multi-state license under such a compact? Please explain. And so that information will also be summarized for both the LACs, the LMACs, and LCACs. But right now, if you want to, you can go and take a look at those responses that are provided in the appendices in the back of the report. I'll open it up for questions to see if anybody has thoughts about the report in general, but I can tell you for the other professions, the path that they have decided to go through in terms of taking this large report and separate it into pieces that you can go through in a reasonable way is they have decided to look at about 2 questions per meeting and go into more detail on those 2 questions at each meeting. The 2 that were the first 2 questions people looked at were question 13, which asked, over the past 2 years, based on your observations and experience practicing in the addiction counseling profession, could you share information on any practice-related issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? And so what we asked individuals to do on those advisory committees was to take a look at what our staff has come up with as summary information, and also look to the back to the open field answers, and then at the next meeting, communicate what stood out to you about the responses. And one of the advisory committees we talked to about this process, I don't think I did a very good job of communicating what we were looking for exactly, because when I went through this, they basically said, well, we could take all those responses and run them through ChatGPT, and it could give us a nice summary. which, I'm not against ChatGPT. It's a good tool. But really, it's the unique blend of the members that serve on these advisory committees and all the different perspectives that you bring that I want to make sure that you have an opportunity to discuss this. And it's not necessarily about just getting from the starting point to the end point. It's about really reading through these responses. It's about kind of, doing the work in terms of going through it and really seeing what surprised you, or what you expected to see maybe was the case, or maybe it wasn't the case. And so I think those things are really interesting. And so so we do have some summary information here, but I would like you to take a look at both parts, the summary information and then also the open answers at the back as well. So most of the committees have looked at question 13. They've also looked at question 15, I believe, which says, in the last 2 years, have you experienced any negative issues involving supervision? And so I think that's where most of the individuals started, was looking at those two questions. For those that have, had a meeting in between your last meeting, they provided some responses on those two questions. And then the two they looked at after that dealt with telehealth. And then there was a question that also dealt specifically with artificial intelligence. So I think as a plan for your advisory committee moving forward, those would be 4 of the questions that the other advisory committees have started to take a look at. So you could take a look at those questions. I would recommend probably, at least for the next meeting, looking at the artificial intelligence question. That way, when you meet in December, perhaps you can make recommendations to the board on any recommended changes to regulations or statutes that deal with artificial intelligence. So maybe that is one to focus on. But the other 3 questions would be relevant if anyone wanted to focus on those 2. The telehealth question, the one involving supervision, and then the first one we talked about that dealt with any practice-related negative issues. So I will stop here and see if individuals have any thoughts, or if anything struck you since the last meeting as you reviewed the original draft of the report. I realize you've had this version 2 just a very short period of time, but if anything struck you since the last meeting concerning the first version, or if you have other thoughts about maybe how the advisory committee could approach these topics. So I'll turn it over to you, and feel free to let me know your thoughts.
I had a thought or question since the last meeting, because I had reviewed that information, and one thing I know I talked about last time was the co-occurring disorders and kind of thinking about how people wanted that information. And then I looked up the LMAC exam, and what I was thinking was that maybe the LMAC exam also changed, like the things that it was focusing on now, or I guess it's called the MAC exam, but the MAC exam is now changing on its focus, and it's not necessarily just focusing on co-occurring disorders, I think. Or am I confused by that?
I'm not sure. I could have Leslie come at the next meeting. She might have more knowledge about that, or maybe some of the other members of the committee might be knowledgeable about that.
That is something I don't know either.
We'll definitely look into that and see if I can find out some information about possible changes to that, specifically about the co-occurring disorders.
Anyone else have thoughts or questions for David today? So is it possible to put review and further discussion of those 4 questions you mentioned on the agenda for next meeting?
Yeah, I think so. And we can kind of go through those 4 questions, and if there's ones that really stand out and the members want to talk about in depth, we can do that. If there's ones that there's not a lot of comments on. We can go quickly through those, but I think it'd be good to put those four on the agenda for next meeting. So let's plan to do that. If members can go ahead and just review those four questions and then come back ready to discuss those the next meeting, that would be great.
And that's question 13, 15, and I'm sorry, I don't know the numbers of the other questions.
So let's see. So question 13 dealt with any negative practice related issues or areas where people needed more education or training. That was question 13 for all groups. Question 14 was one that dealt with any issues involving telehealth.
Telehealth. Okay.
Question 15 for two of them, and then 16 for LCACs dealt with any negative issues involving supervision.
Okay.
And then I believe it's that next question, which is question 16 for LAC and LMAC. And I think it must be question 17 for LCAC, which was, do you currently use artificial intelligence in your practice? And if you do, in what areas do you use AI? And if I recall correctly, I think that one is probably a fairly quick read. That open-ended response was on page 95 for the LACs, and it's only about a third of a page. Because the dominant answer was no, with about 95 of 127 respondents. But I thought it was really interesting in terms of the tone of some of the people that responded, because some people said no, but investigating, and some people said no, not sure, or some said not at this time, but may use it for this or this, and some said absolutely not. And then I have heard from a few people that this survey was done in February, and given how artificial intelligence has just evolved this year, maybe some of their responses today would be a little different than how they responded back in February. But we have this point in time information, so we can work off this for now. But yeah, I would take a look at that AI question as well.
Okay. So that will be on the agenda for the next meeting.
Yep.
Okay. Moving forward, speaking of AI, the next item under old business is continued discussion of regulation of artificial intelligence. My understanding is the board is wanting this to come back to the advisory committees to get advisory committee members' thoughts on guidance, general guidance, as the board is trying to figure out what if the board should provide guidance to licensees across all the disciplines that are under the umbrella of the board regarding the use of AI. So I wonder what you all's thoughts are on the use of AI in practice, how you're using it in AI. I know we've spoken about this briefly. David, did you have other things to add to that?
Just an update. At our past meetings, we had talked a little bit about federal legislation. And at one point in the federal appropriations bill, there was some language that would have restricted states from being able to regulate artificial intelligence for, I think, 10 years. And I was researching that. I think at the last meeting, it looks like the final version of that appropriations bill that did pass, that language had been removed. So I don't think that's something that will be interfering with our ability to discuss this topic or make recommendations, but I will continue to monitor any federal legislation to see if it would restrict us. But it seems like right now that's not something we need to worry about.
So I'm not even sure how to begin this discussion. I know, Mike, you said at one time, AI is here. I agree. And in the practice I practice in, it is still an absolutely not. but I know we're one practice. Can you all give me thoughts on your approach to how AI is evolving in many areas of our lives?
I recently saw an EHR demonstration of an AI feature, and that was a recording of a session that would then generate the summary note for the session, the DAP note or the DARP note, and there were different types of notes it could generate from that, or different formats, whether it be the DAP, the DARP, or any of the others. And then there was information in that presentation about how long the recording was maintained, and what exactly was done to keep that session recording secure. I think it was deleted automatically after a certain number of hours. It was 24 hours or 48 hours or 7 days. I don't recall exactly, but that was one way in that they shared that was being used, and so there would be more developments in their next update with additional AI features.
Did they give you any information on how effective an AI was in creating that like DAP note? Obviously, it was a presentation. They weren't going to show you something bad.
Yeah. Yeah, so they did allow us actually to do a mock session in which another part of our leadership of team and I conducted a mock session on that meeting that we were on, and then it generated the notes, and the notes were really accurate. The transcript was really accurate, as were the notes. They also had a feature that required that a certain percentage of characters were required to be changed from what was generated by AI to what the final note was. It was saved into the client file and the EHR. So that was a safeguard preventing people from just using the AI generated note without having made any sort of edits to it whatsoever.
Okay. And in that case, where was the information going? Like you said it, you mentioned there were efforts, of course, being made to keep it secure, but
Right. So if I recall correctly, it was being maintained probably in the cloud. It was a cloud-based EHR, and then was automatically deleted after a certain period of time. But as far as the recording, and I assume that the transcript and whatever sample note was generated as well.
That's the model that I've seen.
okay. Thoughts, recommendations for the board?
I didn't see anything inherently wrong with that feature that I was shown. I think that that those safeguards to ensure that the note is edited somewhat before it's finally saved is an important safeguard that it have. And if that's going to be permitted, if use of AI is going to be permitted in that capacity, then there being some sort of similar statutory requirement or regulatory requirement stating that anyone using AI make those changes, a percentage of character changes.
I've seen it being used in similar fashions for group notes, individual sessions, that type of thing. I've also seen and know of some companies that are looking at it to use more on the UR type of side. So to using AI to pull data from different places in the chart for billing purposes, instead of somebody going in there and pulling nursing notes or session notes or whatever from that standpoint. I can tell you, interestingly enough, my vet uses AI and so does my pediatrician. So when I go into their offices, they have signs on the wall saying that recording devices are being used. And if you're not comfortable with it, to let them know and they'll turn it off. But I asked them about it because I was curious. And they said it's similar to that. It records the session and helps them write their notes. And I didn't push farther than that because that's not what I was there for. But it is interesting, and places are doing it. The pediatrician probably has a lot more regulations, I'd imagine, than the vet, though.
In the demo that I saw, they did mention group therapy sessions and indicated they were still kind of struggling with the group therapy just because picking up and discerning the different voices. I don't think that the AI was quite there yet. I think there was another one that used different microphones, that everybody who was participating used the microphones, and then whoever was speaking it picked up that specific microphone and could generate the transcripts and sort information that way.
I'm guessing clients would have to sign a pretty detailed consent. Considering if we have students, like I work in a practice where we have psychology students and they record all of their sessions, and there's an extensive document about giving permission to record.
I've seen pretty extensive ones, and I've seen ones that are pretty simple.
Okay.
Depends on the EHR that it's embedded within. I think from regulation standpoint, I don't know how we would do this, but it would probably need to be an AI that's attached to an EHR in some way versus just turning on the record on ChatGTP and seeing what it'll give you, because that security on that one, that's kind of frightening. And I do like that percentage of, making sure there's some kind of edit if for no other reason they've read it. They read the note. I know one that I saw, you actually had to attest that you actually read it, the note was accurate, and all that kind of stuff was one of the way they did it instead of the percentage of change.
Okay.
They're scary accurate, by the way.
Okay.
Yeah, I think about the training facilities where we do have a lot of recordings that are involved, and so there is and we've been doing this for decades in terms of like recording sessions and things like that at certain training clinics. But there is, however long or extensive, there is a process to be able to talk about that or discuss that in terms of where the data is being kept, how long it will be kept, and when it will be destroyed. And use it as when I was at training clinics, it was like a closed circuit versus like I'm a little skeptical of a cloud. I'm not sure what that is or where that's going. So what Michael was saying, like, is it connected to an EHR, or is it connected somewhere like within that agency's framework where they can like, manage the data really well or better. And so that's something that I would just, if in terms of like regulations, similar to like how we keep our case notes, like behind two locked doors or two locked whatever, things like that, like two safety security measures or something like, whatever. Or just how long are they keeping this data around, or the recordings, something like that could be helpful, I think, maybe.
Any other thoughts today? Do we feel like this is something we're in a position we could make any sort of recommendation to the board?
And Jill, I would maybe recommend waiting to the December meeting just because
Okay.
there is that question on artificial intelligence from the survey.
Okay.
And so
Sure.
maybe you could use some of the responses from licensees to kind of aid in the recommendations too.
Okay. Certainly. Okay. Any other additions to the conversation today? Then I think we can move on to finally new business. The first item on the agenda for new business is review and discussion of Pennsylvania Association's Addiction Counselor Program. And I know that there is an attachment that was in your packet. I'm going to ask David to frame this discussion for us today.
Yeah, so this is something that came up at the board meeting. I believe it was the July board meeting, but this is the first opportunity that the Addiction Counseling Advisory Committees had a chance to meet. This is something that came up towards the end. I think some of the members of the board also serve on some other committees that deal with mental health topics around the state, and some of those groups have been looking outside the box at creative workforce solutions, and one of them had come up with a proposal of something similar to what Pennsylvania is using. And I admit I am not the most familiar with Pennsylvania's system, but I was able to pull some information from the Pennsylvania Certification Board's website. So I formatted that for you in the handout in your packet. The information that kind of was briefly discussed at the board meeting was some individuals thought that perhaps something similar to the Associate Addiction Counselor program they have in Pennsylvania might be helpful as a way to get individuals into the addiction counseling profession. Currently, right now in Kansas, we have, tiered licensure. We have the LACs, which require a bachelor's level license, the master's level, and then the clinical level. And a couple of years ago, as a way to be helpful, the board did put forward some language that was adopted by the legislature and changed statutes to create a student temporary addiction counseling license. And I think it's safe to say that has been very successful. I was just running the numbers here to look to see how many student temporary licenses are currently active. And I think there's about 53 that are currently active. And that does not count all of the ones that individuals previously held as sort of a bridge towards getting their permanent LAC license that became obsolete once they got their LAC license. So I think that has been good. I think one of the complicating factors may be reimbursements, and that is an ongoing conversation with representatives from the Department of Aging for Aging and Disability Services and also the Department of Health and Environment, trying to help them understand, why these things were created, what the checks and balance in the process are for. And so I think in the same area of looking at reimbursements, maybe some individuals looked at this Pennsylvania model and said, perhaps this would be something that would be helpful as well. So it seemed that the best committee to look at this model would be the Addiction Counseling Advisory Committee. So I wanted to present it to you today, and I guess I wanted to ask if a few of you wouldn't mind doing a little research on your own and maybe coming back to the advisory committee in December with some thoughts. I was not in my current role when addiction counseling was licensed. I've tried to do a little bit of research to hear what some of the conversation was when addiction counseling made the transition from the way it was previously organized under SRS and a lot of the registered versus licensed and some of the transition and how things have changed. I know Jill and I have had some conversations about how addiction counseling is treated differently in different states. And while there's a same level of there's a certain level of standardization for a lot of professions in addiction counseling, it doesn't have the same level of standardization in terms of the terminology, the way that individuals are authorized to practice. But we are trying to make sure there's good standards. We're making sure that we're protecting the public by providing oversight and the ability to regulate practitioners. And so that's where we're at today. I wanted to turn this over to you and just kind of admit that I know very little about Pennsylvania's model and ask for your assistance if you don't mind taking a look at this. And then if there is a recommendation that could be incorporated by the advisory committee to make back to the board, that could be helpful the next time the advisory committee meets. If there's not a recommendation, that's okay too. but I thought this would be the best group that could look at a proposal like this. So do any of you have any questions, or any of you have any comments you'd want to make about this topic?
Yeah, a few.
Please,
So I
Mike, I
can't,
was hoping.
I can tell you that, being at community college, where they're at the associates to the bachelor's, I don't keep track of the number of folks that when I tell them you have to go on to get the bachelor's, go, I'm done. They're not going to do it. But there's a fair share that do that. Having a secondary type of or an associate level type of thing, I think there's definitely market for people that would be willing to do that. I would suggest, at least my understanding of it, I don't know that we would necessarily have to go with one specific state model, but if we looked at how the ICRC has structured their credential that is reciprocal, because that's what typically happens in the states is they're either ICRC aligned or they're NADAC aligned. And there's variation, absolutely, lots of variation between the states. But I think if we look at that, then it would be one of those, because I looked at the numbers there, the 2,000 hours and all those kind of things. That's pretty similar to what Missouri's got their MADAC 2, which I think is their second level of it's the base license that someone can keep, or certification that they can keep indefinitely. But it's a training one up to the full certification. So I just think if we make sure we look at what ICRC has basically been structuring, it will help if we then get to that conversation of reciprocity again.
What is ICRC?
You would ask
I'm
me
used to
that.
NADAC, so I don't know what that
So
is.
the International Certification and Reciprocity Consortium.
Yeah, thank you.
Oh, okay. Okay, that makes sense. Yeah, because I know like for our curriculum at Washburn, like we are NADAC aligned, and so then with the BSRB. And if I think about this associate level, my main concern is honestly reimbursement, because I know people even with like the student licensing one, they're really confused about that, and they're asking us questions, and I'm like, I can't, I can't really say anything about like, will it, count for something? But then with the associate level, would that then cannibalize the student licensing, and would those even like be necessary anymore? If they could just get the associate license. So I would just making sure those policies, I guess, like make sense. Um, and then if we're talking about other models, there in other states, there definitely are people like from Texas who um, we have a lot of people like the LCDCs, is I think what they're called, and that's even to all they really need is like a high school um, degree, diploma to be able to do that. Um, so yeah, there are different licenses, but I mean, adding these licenses might sound good. I really am concerned about like, will there actually be employment for them as well as reimbursement for these agencies? And because are we just adding them like because we just want to get more money, but like, are they actually leading to something? Is what my concern is. Because we don't mind training and working with everything that's out there, but is it leading to something?
I'll just echo what you had to say there at the beginning of that is it comes down to an issue of reimbursement. I mean, the idea is to build the workforce, but if you built a workforce that can't be reimbursed for the services they're providing, then you're not going to have employers who will hire the people that you're certifying. And it gets a little bit messy. I think currently KDADS recognizes the licensure, and so for clients who are funded through federal block grant funds or the state opioid response funds, then I think you're able to get reimbursement for those services. But if they're funded through Medicaid or private insurance, then you can't. Which then makes like group therapy really tricky, and then I've heard as this has come up at some trade association meetings and things like that, people say, well, put your student LACs in your residential programs. That way you can hide what it is that who they're providing service for, and that just seems really icky, that there would be a licensure type whose services kind of get hidden, so that providers can seek reimbursement for those services. But I wonder if, there is a level of certification. I think Oklahoma may do something like this, where there's a certification, and Crystal, you may know a lot more about this than I do. Certain things can be done, assessments maybe, and a few other tasks, but not counseling or therapy.
Yeah, it's been a little while since I looked at Oklahoma's stuff. So they had a CADC, which was their bachelor level staff. LADCs have to be master's level, and really that's all people are master's levels. And then they have added the MH credential for the mental health piece also. CADCs, they kind of phased out. And my understanding is that you have to be grandfathered into it. I don't know if they're adding more into it. There was a concern about the lower levels, basically, again, for reimbursement and then just quality of care.
Which was part of the original discussion for the LAC in Kansas. I
Right.
do remember that. I was just barely in the field when that started. So,
Yeah, and I don't know if you looked at something like assessments and things and looked at what they were doing to make sure that they had that skill set to do it. But reimbursement is hard even with LACs, much less the student licensures or an associate level license. I mean, if you're looking at VA or private insurance, they want master level staff performing those if you're going to get reimbursed for it.
So I'm going to walk in a territory that I know very little about. So I apologize if I get some of this wrong, but I've been talking more with representatives from KDADS over the past couple of years. I've been part of a group where we applied for a grant to receive some national assistance as we look at things like workforce issues. And also the Board of Regents was part of the initial team, and they've worked with us too at trying to figure out career pathways and different things like that. One of the things that we discussed was the Kansas Promise Act scholarship. And I'm not sure if you're familiar with that, but I know just a little bit about it. And it seems that it was created by the legislature to assist students who are enrolled at specified high wage, high demand, or critical need industry programs at eligible community colleges and technical colleges. And the scholarship is only available for 2-year degrees and certificate programs, and bachelor's degrees don't qualify. So as we were looking at some of the professions under the BSRB, with the bachelor's level social work and bachelor's level addiction counseling for the LACs, the student temporary has been a nice bridge to get people to the LACs, but there was sort of at least a thought of, would there be any potential 2-year terminal designation where someone could do something for 2 years and then be able to get that, and then potentially would a program like that qualify for something like the Kansas Promise Act scholarship? I think there is a requirement that if you get that scholarship, the student agrees to live and work in Kansas for 2 consecutive years following graduation. And there's a list of some of the programs that are approved on the Board of Regents website. But and like I said, I'm getting into an area that I know very little about, so it's always dangerous to kind of walk down that path. But as we're trying to think creatively and help the board and have good discussions in these areas, that is something that I talked with that group about, and I thought maybe this would be something to bring up with all of you as a possible reason why there may be some value in a 2-year permanent type designation that wouldn't necessarily be a path to a 4-year type bachelor's degree. Anybody have thoughts on this conversation?
I'd love it, but the Promise Act, I know, like the degree that we have here, that's a 2-year degree specifically in addiction stuff, is not eligible for what the Promise Act has done so far. And I think it's basically, if my memory serves, it's because they can't walk out with a job. I think the goal behind that is they're employed upon completion, is my understanding of that particular scholarship program. So, which makes sense to me. I mean, I get it.
I think about that because we do partner with Blue Tech. That's just down the street with us as well. And so we do have like AAS degrees. We've not done an AA or AAS degree for addictions counseling because again, like it doesn't necessarily lead to anything. They would have to come to us anyway to get the bachelor's. But the things that we have talked about, which is very separate from addictions count, well, not very, but separate, is behavioral health technicians. But that is something that is where which it could be, for like healthcare and maybe working out with it, finding a job and things like that, and also potentially trying to work with KDADs to get some kind of certification for that, or in some way get some kind of certification. But yeah, I just think about the job market and reimbursement, and if that, especially since like a lot of agencies are now CCBHCs, and they're wanting to have a lot more requirements of like co-occurring and mental health and things like that. It starts to be a little tricky for that. And I'm just not into creating frivolous things that look good, but they don't lead to jobs, and it's false advertising for students, and they're paying for something that doesn't go anywhere. And I just would hate for that to happen. But if we can definitely connect it to something that makes sense, then I'm definitely on board with that.
Yeah, and what we're hearing, in terms of some of the national conversation is, there are students that are staying in school longer, and so and for good reason, I think, because if you look at the long-term history, the higher level license you have, odds are the more opportunities you're going to get at different positions, and the higher you're going to get reimbursed for. So the more money you're going to make, which is great. But does mean that if you look at our licensing totals, even though those numbers have gone up quite a bit over the last 10 years, there has been a shift. And so we have far fewer bachelor's level social workers, and instead we have more master's level and a lot more clinical social workers. But a lot of the areas of need right now are sort of those lower level bachelor social work type positions. And even some of the schools are saying, you could get your bachelor's level social work license, but we would say, maybe consider, don't get in that and just, focus on school and then jump into the field when you get your master's. And on an individual level, that may make total sense. But that's just kind of what I'm hearing is like the need is at the lowest level, but that's kind of where we're seeing sort of the numbers that are decreasing, even though the overall numbers are increasing. And in terms of our history, the Behavioral Sciences Regulatory Board was formed by the legislature in 1980 when they took the existing social workers and psychologists and put them together. And at that time, there were actually 4 levels of, at least to my knowledge, I believe there are 4 levels of social work licensing. And the reason I say that is because one of the lesser known things that happened when those 2 agencies were put together is that they said the associate level social workers, the board could no longer do new licenses at the associate level, but for anybody who had that license, they could continue to renew them. So now 45 years later, when we look at our licensing totals, there are 4 people at that associate level social work license that have continued to renew their associate level license for 45 years past when no one else could get licensed. So we used to have that little group, but it's gotten smaller and smaller. And now we're kind of returning to a conversation of saying, for the individuals who've been able to stay in school longer, they've done really well. And overall, in terms of numbers, we are adding a lot more people to the field, but there is still that need for people at the lowest level to get their foot in the door. And if there's ways to think creatively about this, that can be helpful. So.
Yeah, and I misspoke earlier. We actually do have something. It's not a addictions counseling at the associate level. Our career ladder looks like for the associates level, we do PCCM, so the person-centered case management. A person can get that at the associates level, and then the BA, then the LAC, then the LMAC, and then of course hopefully moving on. So, but that's how we get people kind of in the door because they can get that certification through KDADs, and that does lead, towards something, and they can definitely advertise that for their, jobs. But the licensing part of like, oh, what will they be? And then also thinking about like, what will they be required to do? Is it just assessment?
Right.
And then the hours for that as well. A lot of those associate degrees require 30 something continuing education hours. So then what would that level look like for the courses they would need to take? It depends on if it's AA or AAS, but yeah. like 200 level or 300 level courses, or what that would look like for them, and yeah, what would they be required to do, I guess is what. Yeah, I probably maybe look through Pennsylvania or whatever, or other states that might maybe have a better model, or but.
I'm wondering what you all think as you are in practice. Like, would this potential, just in theory, uh, associate's certification or licensure, do you have a sense of what those folks would do? That's what Zenova was saying, but I agree. It's like, are we creating something that won't have any financial impact to fill a need, because there is workforce need, but if there's no reimbursement.
And then
Case management.
I may be wrong about this, but it feels almost like KDADS is going to have to update its standards to include the modern language of BSRB licensure at these different levels. What the current standards say are things like it must have the dated signature of a qualified staff according to RO 330. And so RO 330, I don't have all the standards memorized by exactly what they are, but I'm going to guess that's the one that says they have to be certified by SRS or credentialed by SRS, without the BSRB language. And maybe when the standards are updated, that can provide some clarification as to what KDAD is willing to accept or allow as far as different licensure types, as they spelled out previously.
Yeah. What I've seen in some of the states that utilize the ICRC training model, which is if you have a high school diploma, let's roll, is they do a lot of group work and some case management types of stuff. They're really the frontline type folks. And then there's usually somebody that for lack of a better term in my brain right now, that's a QUIMP, a qualified professional that's got the master's level, is overseeing it all, but they hand it down. And there's this little space right in between case management and the master's level counselor where they do their thing. I know a couple of programs that they're identified as basically a substance use counselor for the folks, but they go in the home. So it's the kind of, like I said, another level up from case management, but still kind of those roles. I do notice that usually it is the block grant dollars, the grants, sometimes the Medicaid that they're able to access, and the commercial insurance is not that's not where these agencies are. They're not using that credential with the commercial stuff.
Well, if the role of the board is ultimately to protect the public, and I was even new or younger in the field when addictions counseling went under the BSRB. So I remember, but I don't remember the details. Do you all feel like potentially this would give enough education, enough oversight to a licensee at the associate's level to protect the public?
I think from my perspective, it would be, I'd need to know to do what? What would their job responsibilities be?
Yeah, I think that if you could collect data from providers that, and I doubt you could do this, but so that if you look at your own organization's disciplinary violations, what type of disciplinary violations are committed by individuals with a high school level diploma versus individuals with a 4-year degree versus the master's degree, then I think you'll see some parallels there between things like dual relationships or inappropriate relationships with clients, really landing at the high school diploma level and that decreasing by the time someone has invested 4 years into a degree, and even less at the time they've invested 5 or 6 years into master's level licensure. So
I think that was the argument back in the early 2000s when it shifted from CAP and SRS to BSRB. Did they have actual data to tell us that? I can pretty confidently say no. The credentialing process and the complaint process at that point, I think, yeah, I think they had like 2 or 3 a year, something like that. So they definitely were not getting that particular piece of the accountability piece and the protecting the public in the same way that the BSRB does. And I don't, too long ago for me to remember why it might have been structured that way or what have you. But I believe that was kind of the premise behind doing the license, was to try to decrease and improve the safety for the public kind of stuff.
And that's what I can remember too. But again, it's been a while. Okay. Is this something we want to provide feedback to the board? Do we have a consensus of thought? David, is this something that you feel like we should, that's a loaded word, provide feedback to the board regarding?
I realize that members of the committee probably haven't had enough time to look too in depth into this individual program. If you had maybe broader recommendations or thoughts, that could be appropriate now. If you needed more time to kind of look into this, and maybe think about if you wanted to make recommendations at your next meeting, I think that'd be appropriate too. So
I wonder if there's an agency there that could tell us what they have them doing and what that looks like. That would be interesting to see. Because again, I'm thinking more along the lines of bachelor level or student staff, and like several people said, that there's lots of boundary issues. There's just, they require a lot of training on the behalf of an agency. Like they don't come out of those programs usually ready to run group and process things with people and do those things. They just don't. A lot of master's people don't either. So I'd be curious what exactly they have them. If you're looking at it from the patient and the quality care, so if you look for it from a workforce, yeah, that's a great stepping stone to get people up into those higher levels. But and some of them, like I said, may stay there, and that is their career path. But I've met some really great peer support and case managers. They're amazing at what they do, but there's limits to what their background in education, what their skill set looks like, and how that would be used for patients. So I don't know. I'd be curious to exactly what those places that are doing this, what that looks like for them.
David, is this something that we can get more information from how this is utilized in Pennsylvania?
yeah, I have their contact information, so I'll try to get some of that information and bring it back to you all.
Okay. Great.
Yeah, it's interesting, Crystal, that you brought up the peer mentors, because what the credentials or what the requirements are to become a peer mentor in Kansas seem to be very similar to what it takes to get this associate addiction counselor credential in Pennsylvania.
Yeah, I think we have a lot of room to utilize peer mentors more than we typically do here, and elevate that position more as a stepping stone into some of the other things, but I don't know.
Okay. We can close that for now. Moving on to the next topic on the agenda, discussion for making up practicum hours for license I know some of the other disciplines have had this discussion. David, could you give me a little bit more background information?
Yeah, so there is a current way that we can ask the board for the ability for someone to make up hours if they attended a program to where that program didn't require the number of practicum hours that is necessary based on our statutes and regulations for individuals that are coming through the licensure path. And it would be for them to essentially request the ability to get a provisional license, and the board would have to approve that, and then they would be able to make up those hours while working under a provisional license. But some of the other professions have essentially put language into their regulations, the educational requirements for licensure regulations, that essentially said if someone applied to the board and the program they attended, the practicum hours were less than what the board would require, they could make up those hours under a temporary license as an alternative instead. And so I think marriage and family therapy moved forward on that just a year or two ago. And so potentially that is something also that could be done with the addiction counseling regulations. If you would be in favor of that, they would be making up the hours one way or another, but it's a nice way to help some additional people meet our qualifications for licensure if they had attended a program that didn't necessarily match that practicum hour requirement that's in our statutes and regulations. So I guess what I would be asking the advisory committee is, this is something that we have one route to go currently for this, but I think it would be cleaner to make it consistent with the marriage and family therapy if you wanted to put that in the regulation. So I just wanted to see if there was any opposition to that for members of the committee, or if not, if there would be consensus or support for us to make a recommendation to the board for that to be added to the regulation.
Just so I make sure, right now, either you finish your practicum hours in your program or you don't, and you don't qualify for licensure.
Right. And I think as a possibility, someone could request from the board the option to do a provisional license. And then that would be up to the board to decide if they would be comfortable with the person making up hours while using a provisional license. Our provisional license statute says if someone is deficient with the quality or quantity of the educational experience that is required, they could make that up under a 1-year provisional license. So in general, that's been mostly used for people making up specific courses if they're missing. But this could also be a path for that too. So that is how it has been used at least a couple times in the past. But for that to work, essentially all those requests have to go to the board to get special approval for that provisional license. As an alternative, you could just say, here is something we feel comfortable with the person making it up under a temporary license instead. And then if you did that, those would no longer need to go to the board to be reviewed and get special approval. They could just move forward in the licensure process a little bit faster.
I like it.
Okay. Does anybody have any objection to that pathway to just, if you're deficient in practicum hours, issuing a temporary license until those hours are made up? Okay.
I think the previous discussion we talked about, would that practicum have to be under an accredited institution? Like, would those practicum hours have to be earned while they're enrolled at Washburn and through that practicum process at Washburn, or through a different university? I just use Washburn because there's another city here, but because I think the quality of a practicum experience, I think we discussed previously, is a little bit different when it's through the university setting. They have the the practicum seminars and those different aspects of a practicum versus someone having something that's pretty unstructured.
My thought was this would be somebody who has graduated, whose practicum didn't meet the hours requirement, that they've completed a practicum with their university setting, but this would be on top of that. David, am I thinking of that correctly?
Yeah, so our current language says that the practicum needs to be at least a certain number of hours for most professions. That was removed for social work a few years back, but for the other ones, there's a specific number of hours in there. And for the ones that have national accrediting bodies like professional counseling, I think it was 350 previously, and then it was modified to 280 to match what KCREP had required for professional counseling. And I think most of the other ones, I believe, are 350, I think is the number of hours. And so I think that is the idea, is that if someone were to, let's say, come to the board and the program they attended, they did a practicum, but the practicum they did was 300 hours. So they're short of the 50-hour because of the difference between our statutes and regulations versus that program they attended. They could make up that difference. So they would still need to have received a practicum, but they could make up the difference in the hours.
Like on the job supervised.
It depends on how much detail we put into it, but I think we could put that information into the regulation if that's preferred. I think there's some flexibility with the language how we want to put it in, and I don't recall exactly what language is put in for marriage and family therapy, but I think whatever the advisory committee would want to recommend is I feel comfortable with bringing to the board.
Yeah, I agree that like on the job supervised by someone would be helpful because these should be students who've already gone through educational standards and like should meet the educational requirements. I'm pretty sure the addictions counseling one, at least the last one I saw maybe a couple of days ago, is 300 direct contact hours, and that I think that's specification. Sometimes people don't have the direct contact hours or something like that. They may have 400 overall hours or 500, whatever, but may not have the specificity of that 300 direct contact hours along with the 30 supervision hours, or technically like 1 to 10 or whatever the proportion or whatever the thing says for the licensing paperwork. But definitely supervised. I think that would be helpful at that whatever 1 to 10 ratio that's expected. I think would be good. But yeah, I'm all for it because we definitely have students who have graduated from other universities and they're trying to get licensed in Kansas, and they'll ask us to take like these are like online universities, not necessarily like from Kansas universities, just I don't know, other universities. And they will ask us if we can supervise them for their practicum, but because we do not know them, we do not have background with them, we do not risk our licenses with students we do not know who have been in our classes. We can't take them unless they want to take multiple more classes, I guess. So I think this would be a good option for those people, especially if they are working on site somewhere. And technically, some people may be even working out of state who want to kind of like come into Kansas but don't have the same kind of like hour requirements. Could be helpful.
Yeah, there's some people in other states where practicums aren't required at all. And they've been working as a licensed master level counselor for 15 years. And then they come to Kansas and then they can't practice all of a sudden. So and like you said, the colleges don't want to do it because you're not theirs. So yeah, I think but having a supervision requirement or saying what that practicum might look like, I think is good.
Okay. Any other thoughts? So is everyone comfortable with making a recommendation back to the board that we do this temporary license to make up practicum hours as long as it is under employment, under supervision?
I have no objections. If marriage and family is done very similar, then that may make sense.
Okay.
Because, like Vanova said, I've had students ask me, "Can I do practicum?" I'm like, I don't know you. No, no idea what you would do at my practicum site. You're not going to, So, uh, and that piece where they, can get the license elsewhere. I've, encountered that one personally years ago. So it's like, oh, I need that class. Okay. I've been practicing 12 years, but okay.
David, is this something that needs a vote or is a consensus okay?
There appeared to be consensus, but it's up to you. You can always vote on something, but if there's a consensus, that's acceptable too.
Okay, does anybody object? Looks like there's consensus.
Okay, thank you.
There's one more item under new business. It's discussion on possible alternative pathway for licensure. In some regard, I feel like we already talked about this with the Associates Addiction Counselor Program in Pennsylvania, but I want to open the floor to see if anyone else has had thoughts about other ways to address licensure other than what is currently established by the BSRB.
Was this the conversation about looking for those reciprocity ways for the states that have like the CADC or advanced CADC, and they've been practicing for 10 years? Was that where my memory may be off, but versus them having to come and go through the educational piece when they've done the technical apprenticeship kind of model.
David, I'm going to turn this one to you.
So I think, this was brought to the board by the chair of the board, and it was kind of referred to each of the advisory committees to discuss. So for some advisory committees, it's a little bit, it may differ by profession in terms of what this conversation means. Because for some professions, let's say there is a test that you take when you get your master's level license, and then a separate test you take when you're getting your clinical level license. For some professions, like let's say master's level psychology, you need a 400 level on the EPPP for master's level psychology. When you're going for your clinical level, you need to get a 500 level. If you pass at the higher level, the first time you take it, you don't need to take it again. It's kind of marriage and family therapy. It works the same way too. And I think one of the questions has been, let's say that you have your master's level license and you've been practicing in the field for a number of years, but for whatever reason, you're really struggling to pass that clinical level test or to get the level on that test to get to what we have set as required for the clinical level. So let's say that you are someone who took the EPPP, you got a 495, and you've been working in the master's level psychology field for 20 years, and you've retaken the EPPP, but unfortunately you could never crack that 500. Is 20 years of experience where people can sign attestations and say that you are a great practitioner, is that sufficient as a substitute for someone to, as an alternative to that testing requirement? Alternatively, for the professions that have a separate test at the clinical level, for example, is many years of practice under supervision, where people say that they think, you would be sufficiently skilled to do this kind of work. Is that the years of experience, are those sufficient as a substitute for a testing requirement? So the testing requirement was definitely part of this. Now, which situations it might affect, or whether there should be another path, and as far as the testing requirement in general, that's a conversation as well. There's been some conversation with social work as far as their standardized test and some issues that people have pointed out in terms of pass rate disparity between different groups, and they've done some studies that have looked at a number of different factors. They've also done a comprehensive review of their examination to look at factors like test anxiety and changing from a 3-option or a 4-option multiple choice test to a 3-option, and reevaluating some of their traditional rules, like, is it important that people don't have a snack if you have low blood sugar? Like, the reasons why people may be unsuccessful that are unrelated to how much you have learned, really just test taking ability. Is that something that can be taken care of so that it doesn't call into question the whether or not you should have a test as a requirement? So there have been a lot of conversation about some of these things in a lot of different areas. With your profession, it's a little interesting because since there are the different models in different states, not just with the test, but also with the qualifications, I think an alternative pathway discussion could go in a lot of different directions. But that is where I think it started with. It was, I think, primarily looking at some of the other professions that say you either need to pass a separate test for clinical level work or potentially get a higher score. And would years of practice be a good substitute for that? For your profession, it could mean a lot of different things, but I think that's where it was originally based. And I think, part of this we've already sort of had a little bit of discussion on when you're talking about alternative pathways to licensure in terms of, are there existing types of license that should be created or would be helpful to have in existence, or would it just take existing practices that people are doing and have a level of license to kind of fit those existing practices? And so I think that's a fair conversation to have. But that is why this item was originally deferred to the advisory committees. And so if you have thoughts on the topic in one direction or another, feel free to share your thoughts. I can tell you in terms of ongoing conversations, as I mentioned, I've had a lot of conversations over the last year and a half with representatives from KDADS. It appears that perhaps as we have increased flexibilities in different types of licenses, there probably could have been more communication in terms of helping people understand what are the standards for different licensure. And so we're really trying to go and be proactive in terms of helping people understand, these types of licenses require this type of education and this many hours of experience, so that we can really see, are there different types of licensure that maybe something similar is qualifying for a different reimbursement in a different state. And perhaps there might be some more reimbursements eligibility here in Kansas too. It's not exactly the main role of the board, but if we can help share information and that affects our licensees in a positive way, that's great too. So those conversations are taking place as far as sharing information on our existing licenses. But if there's more work to be done to think creatively, we can do that too. And if there's no recommendations today or thoughts, we can just kind of either if there's no recommendations or if there happen to be more in the future, we could always kind of return to it.
Okay. I don't have any specific thoughts on this one. Does anyone else have comments or thoughts?
If social work, I think you said it was social work, has looked at the test and said, okay, maybe we need an alternative measure versus just the test to be able to move forward. Is there anything that's followed up to say the alternative measures they've picked is useful or actually worked? Because I know in the academic setting, that's the same thing. They've kind of, tossing the testing away, and the alternative measures are the piece. And I don't know that we know yet whether the alternative measures are successful in adequately placing in students. So I'm assuming we'd encounter the same thing with professional. But
I know that there are states that have done away with the ASWB licensing exam for social work completely. And I think North Carolina is one of them. I am not familiar with how they determine, other than a degree, if their social workers are prepared. I don't think Kansas has done that.
No, and I think part of the reason, and I think Illinois is another one that has done that. It's a small handful of states, but a lot of states have had that conversation. I think one of the biggest factors why, I think a lot of states are continuing to have the conversation but not moving that direction right now is their multi-state compact just passed about a year ago in enough states, and that compact does require individuals to have taken a licensing examination. And the licensing examination, the only national one right now is the ASWB licensing examinations. So potentially a state could say we're no longer requiring the standardized test, but that would likely mean that their licensees could only practice in that state and then wouldn't be able to go to other states to practice because they wouldn't meet those requirements. So, and also they wouldn't be able to practice under the multi-state model. So if they did want to practice in other states, they would likely have to get licensed in every state they'd want to practice in. So, so that the multi-state compact coming at this time has been a factor, I think. What
about case studies? You can do something like, I know that the ICRC, when I did my testing way back when, I had to do a case study also where you stood up in front of them and they asked you 600 jillion questions regarding care and ethics and all kinds of related to a specific case. I don't know. It was not instead of a test. It was like in addition to. But I know at least one girl that I worked with at the time, she had issues with test taking. She's dyslexic. And so that she did fine with. So because it was a different format, she was being able to verbally do it. It was in front of a panel, kind of like you do a panel interview, and it was done that way. I don't know, again, that necessarily replaces anything, but if you have somebody that test taking anxiety or reading disabilities or other things come into factor, that may be an alternative to that or in supplement to, I don't know, maybe an average of the two.
Yeah, that reminds me of the psychology profession a little bit, because for a lot of states, they have a standardized test that was to gauge knowledge, and then an oral examination that was kind of a skill assessment. Unfortunately, though, the oral examination in a lot of states was sort of attacked as being too subjective. And so that caused the National Association, the ASPPB Association, to develop a replacement for that, a standardized test called the EPPP2. But then there was not a lot of movement by states to want to adopt both tests as a requirement for licensure. And so, you know, it's a tricky thing, because on one hand, you know, that the oral examination did provide a different mechanism to gauge some of that. However, the subjectivity attack was also something that was difficult to defend, I think, legally in some of those different states. And so right now they have a task force that's looking at taking both of those pieces, the knowledge and the skills, and combining it into one integrated examination for psychology. But for a lot of the professions, there's only one knowledge-based test. There may be, you know, other factors that play into it, like references and, you know, someone who can do an attestation that says, I have observed this person and I can attest that they are competent at certain levels. But that's what I recall. So.
Then I got nothing.
Maybe this is one we can just table for now. So moving forward, our next meeting is in December. David, would you be willing to send out a poll to determine a date that
Sure.
works for folks?
Happy to do that.
Okay.
And I included a few different items. Normally I don't include upcoming things, but I wanted to put a few things on your radar as members. So Jill and I will be attending the NADAC conference coming up here. This is something we've been trying to take steps forward. We talk about the Kansas BSRB as 7 agencies in one, because we have 7 different professions, whereas in a lot of other states, these might be separate boards or separate agencies with limited resources, but by coming together, we're able to get some efficiency and work together on a lot of these things. And so one area that we wanted to take a step forward was addiction counseling and becoming more familiar with what's going on at the national level, building connections and networks so that we could get information and share information. And so Jill and I will be attending that conference for NADAC and bringing information back. And then speaking about training, every year we do an annual training for board members and advisory committee members. We usually have done that at the advisory committee meetings, but it does take up about an hour of time from your meeting. And so as an alternative this year, what I was proposing to do was to basically pick out 4 times and then asking all the board members and advisory committee members to just pick one of those 4 options that you could attend. I will do all 4 of them, but just to kind of spread it out. So that way your December meeting, you'll still have your 2 hours that you can work on your committee work, but you'll also have the ability to go through the training too. So, and it kind of makes it a little bit more efficient for me because I'll be doing the training 4 times versus 7 times if I do it in every advisory committee. So. So I'll spread out sometimes. Usually I'll put a couple of them in the evening and then maybe one around the lunch hour and then one at a time. That seems like we have a lot of availability, but I wanted to kind of let you know about that. If individuals can't attend any of the 4, we'll figure out a way to get the materials to you. And since your committee doesn't have any new members, you've all heard this information relatively recently, but it's always a good reminder and refresher. So. And then the last item for the next meeting. So there was a bill that passed about 3 years ago, and it put all state agencies on a 5-year rotation where we will have to come before the legislature and basically go through all of our regulations for all professions and explain, are these necessary for implementation of state law? If they're not, are they helpful? And then we'll have to answer some additional questions about them. And if there's no longer a need for the regulations, we will need to repeal them. Or make modifications or changes. And we have brought a lot of regulations to you already in terms of the definitions and educational requirements for licensure, continuing education, unprofessional conduct. So a lot of the really meaty ones we've brought to you over the last few years. But there's a handful that I don't think you've had a chance to review. And some of these are kind of short. Some of them are just a paragraph. But I'd like to be able to say that over the last few years, we have brought every regulation before all the advisory committees. So I wanted to put a few on your radar between now and the next meeting. Just go ahead and take a look at these on the BSRB website. We'll try to move really fast through these at the next meeting. I'll have our staff identify if there's any changes they think need to be made. If you have additional recommendations on changes, let us know. But we'll just kind of go through these. I would like to be able to say that, you know, all of our advisory committees have been diligent about the regulations, and I think we've done a really good job. I think we are going above and beyond compared to what a lot of agencies are doing in terms of reviewing all these regulations. But I think we have in total somewhere around 120 to 130 of them. And so we still have a little bit of work to do to make sure that we review them all and have the opportunity to submit recommended changes. So just take a look at these, and then if you have requested changes, we can talk about those at the next meeting.
Okay. The final thing on the agenda is adjournment. Could I get a motion to adjourn the meeting?
I'll move to adjourn.
In a second.
I'll second.
All those in favor of adjourning the meeting, say aye.
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 All those opposed, same sign. Meeting is adjourned. Thank you all very much for your time today, and have a good fall.
Thank you.